This morning, the Biden administration is sounding the alarm on the emerging threat of xylazine. It's a veterinary sedative, and it is a mixture that is now being combined with dangerous drugs, deadly drugs like fentanyl. It is important to note that the veterinary tranquilizer is not technically an opioid, so it doesn't respond to opioid overdose antidotes like naloxone. Also, you've heard that called Narcan. At this point, the drug has impacted every single region in the United States. And now the Office of National Drug Control Policy is gearing up to publish a government response that includes evidence-based prevention, treatment, and supply reduction. So they want to fight this problem really at every source. Joining us this morning, Dr. Rahul Gupta, White House Director of National Drug Control Policy. Boy, you've got a tough job on your hands with this one. When I hear about this cocktail of fentanyl mixed with this tranquilizer drug, what is your message to the American public about the mixture of these two very, very dangerous drugs?
Well, thanks for having me, Marni. I think it's really important for Americans to know that this deadly drug has pervaded all 50 states nearly, and it is a dangerous drug. It was never meant to be used for human consumption. And when xylazine gets mixed up with fentanyl, which is the case in so many places today, it can really cause severe and life-threatening impact. That includes lowering your breathing, your heart rate, and as well as blood pressure to unsafe levels. Oftentimes it can be deadly. Also, it has terrible withdrawals. And in addition, it's got some really serious flesh wounds that can also often lead to amputation of the limbs and complicates the reversal of an overdose from fentanyl, as you mentioned, because naloxone or Narcan doesn't respond to get the reversal of the overdose from xylazine component.
How are people getting a hold of this drug in the first place?
Well, what we find is that this is primarily being mixed with fentanyl by traffickers and transnational criminal organizations to make it more profitable at the end of the day. Now, what we're looking into is whether it's coming as diversion from manufacturers or its own de novo supply, manufacturing. And this emerging threat designation allows us to double down on the efforts, both from law enforcement, but also from public health side of this, to increase testing and develop some treatments that currently don't exist.
So talk more about the White House's national drug control strategy, some of the things that you all are now putting into motion to try to combat this.
Well, from day one, the president has been very clear this is top priority because we're losing an American every 5 minutes around the clock. And we're making steady progress by increasing treatment, getting naloxone or Narcan across in every communities. We want to see this accessible just like a smoke alarm or a defibrillator in public spaces. But also at the same time, we have to make sure that as we build the addiction treatment infrastructure, we're also going after the drug traffickers and their profits. And xylazine complicates it. If you thought fentanyl was dangerous and deadly, xylazine mixed with fentanyl makes it much more lethal and destructive. And that is why our strategy is now not only declaring the emerging threat of xylazine, but also taking proactive steps to make sure more Americans are able to find and test for this. We still need a point-of-care testing for xylazine. We want to make sure that treatments are available. We want to make sure that we look at the scheduling actions without interrupting the legitimate veterinary supply of this medication. And then focus on getting people help as they need it when it concerns fentanyl, but also xylazine.
I appreciate you addressing that because, as you know, critics have said criminalizing the drug doesn't focus enough on prevention. I do appreciate that you said that there. There is bipartisan legislation in Congress, Dr. Gupta, to classify this as a controlled substance, xylazine. What impact would that have on the fight to get it off the streets?
Yeah, so our focus here is twofold. One, not to interrupt the legitimate supply of xylazine as an animal sedative for farmers and the agriculture industry, but also at the same time, make sure that the diversion or otherwise the illicit xylazine is taken off the streets. So it's both folds, and we're working very closely with Congress to get that solution in place. We don't want to interrupt the legitimate supply, We also don't want illegitimate supply to be on the streets killing people.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.